making a difference in Arnot Health's quality of patient care. That's the job of case managers like Stephanie Tryon and Wendy Spady. Both stepped into the role as healthcare facilities started to see a greater need for patient-based support.
When I became a case manager back in the mid-90s, it was a new role within our community. A big part of the job back then was resourcing, because we had to learn everything that we needed to know how to be a good case manager on our own. So it took a lot of resourcing, a lot of phone calls, a lot of, who can maybe answer this question or at least in the direction that we need to find out information, how we can best help our patients.
Handling everything from treatment plans for medical conditions to communication with insurance companies and navigating out-of-pocket expenses for prescription medications.
As a case manager, we work very closely with all disciplines within the hospital.
Aside from doctors, nurses, and surgeons, case managers coordinate with social workers, occupational therapists, speech therapists, pastoral care, dietitian, and anyone else who may come into contact with a patient.
Being in the hospital sometimes poses very difficult times for patients and their families, and we like to be able to help them navigate those situations and guide them in making decisions, and sometimes being the person who can pull things together for them, because they have so many different disciplines seeing them at one time.
Looking beyond care received in a hospital bed, thinking about what patients may need when they're discharged.
Going into a different level of care, if someone needs rehab or they need long-term care because it's being difficult to manage them at home and their health doesn't allow their families to be able to provide the care that they would like to, but just are not able to manage for their family. So we help them make decisions and guide them in the direction that they need to go, if it's not going to be back home.
Healthcare is complex. Case managers start working with patients from the day of admission.
Part of our job is doing the discharge planning, and that starts on day one. When a patient comes into our hospital, it's too late to start discharge planning on day 6 when they're going home and they need services.
And Stephanie and Wendy use their nursing backgrounds to
anticipate our patients' needs, discharge needs, so that we can ensure a safe discharge. We can keep them out of the hospital.
As advocates, case managers serve as mentors, motivators, and monitors to provide the best patient outcomes.
I think in order to do this job, you really truly have to care about people and what you're doing. And so that's something that I think is important, that is in healthcare, that we never lose the fact that we truly care about each other and about the patients and the families that we serve.
Arnot Health is looking to add new case managers to the team, offering weekday shifts, limited holiday commitments, and a $10,000 sign-on bonus. For more information, go to arnothealth.org/careers. For Arnot Health, I'm Lexi Cutmore.